A red, itchy patch after Mounjaro, terzepatide, or Wegovy, semaglutide, can look like an allergy. Most injection site reactions stay local and improve. Allergy becomes more concerning when symptoms spread beyond the needle area or affect breathing, the face, or the throat. The color alone cannot decide it. Location, change over time, and symptoms elsewhere in the body reveal the difference before your next dose. These medicines are delivered into the fatty layer beneath the skin. The needle and liquid briefly disturb nearby tissue. Small blood vessels widen, and nearby cells release signals that can create redness, itching, swelling, tenderness, or a firm bump. That is irritation at the injection site, not automatically an allergy. A typical local reaction has borders you can follow. It appears where the device touched, remains limited, and gradually becomes less noticeable. A small bruise or drop of blood can also occur when the needle reaches a tiny vessel. That can look dramatic without being dangerous. After your injection, first check whether the reaction stays local and begins settling. Trial results put that pattern in context for each medicine. In adult trials, injection site reactions occurred in 3.2% with Mounjaro and 0.4% with an injection without the active medicine. That makes the reaction uncommon, but clearly possible. With Wegovy, the rates were 1.4% with the medicine and 1% with an injection without the active medicine. The comparison suggests the injection process may also contribute. Those numbers do not predict what your rash means today. A usually mild local reaction can still need review if it worsens. A rare allergic reaction can still become urgent. Your symptom pattern matters more than a percentage printed in a study. Allergy is a broader immune reaction. Hives may appear away from the injection site. More serious allergic reactions can cause deeper swelling, called angioedema, around the lips, tongue, face, or throat. Anaphylaxis is a fast, severe allergic reaction that can cause breathing trouble or a dangerous drop in blood pressure. One person has an itchy circle on the thigh that looks smaller the next morning. Another starts with a tiny needle mark, then develops widespread hives and swollen lips. The second reaction is more dangerous, despite the smaller mark where the injection entered. Timing helps, but it cannot make the diagnosis alone. Local irritation often appears soon after injection and fades over hours or days. Serious allergy may begin quickly, but delayed skin symptoms can occur. Watch what happens next, not only when the first spot appeared. Not every worsening patch is irritation or allergy. Infection can look similar at first, but it usually becomes more painful, warmer, and more swollen instead of steadily improving. Drainage, fever, or red streaking raises concern. That pattern needs prompt medical assessment rather than another injection through the same area. Even after separating irritation, allergy, and infection, previous normal doses do not guarantee that the next reaction is harmless. People sometimes continue injecting because many earlier doses caused no problem. Others stop permanently after one small red patch. Both decisions ignore what the current reaction is doing. Past normal doses do not make a spreading reaction safe. The size of the patch can also mislead you. A large local patch may look frightening, yet remain less dangerous than faintness or throat tightness with little visible redness. The patch's size and color attract attention. Faintness, breathing trouble, and facial swelling determine urgency. That is why photographs are useful. Take one when the reaction appears and another several hours later. Include a ruler or familiar object for scale. Record the dose, body location, timing, itch, pain, and symptoms elsewhere. A timeline shows whether the area is fading, stable, or expanding. Once the pattern is documented, review the injection technique because poor technique can create irritation that mimics allergy. Use the abdomen, thigh, or upper arm according to the device instructions. Choose a different spot each week. Avoid skin that is bruised, tender, red, hard, scarred, thickened, or damaged. Using the same spot repeatedly can keep it irritated. Let cleaned skin dry before injecting. Hold the device as directed, and do not rub afterward. If a small amount of blood appears, apply gentle pressure with clean gauze. These steps reduce extra skin injury. They cannot prevent a true allergy to the medicine or another ingredient. Even with good technique, a reaction after a higher dose may seem to prove that the dose caused an allergy. The dose increase may be related, but timing alone does not prove that it caused the reaction. The injection location, how firmly the device was pressed, and the skin condition may also differ that week. A clinician should review a larger or repeated reaction before the next dose. Instead of blaming the higher dose based only on timing, check 3 things. Location shows where the reaction began. Change over time shows whether it is improving or spreading. Symptoms elsewhere in the body suggest more than local irritation. Those 3 checks matter more than redness alone. Start with location. A reaction confined to the needle area points toward local irritation. Hives across the chest, arms, back, or legs point toward a broader immune response. Swelling of the lips, tongue, face, or throat is not a routine local reaction. Then judge change over time. Mild irritation should remain stable or begin improving. Expanding redness, increasing pain, blistering, or stronger reactions after each weekly dose deserve review before the next injection. Worsening warmth, drainage, or fever makes infection more likely. Finally, check breathing, dizziness, and faintness. Wheezing, throat tightness, shortness of breath, severe dizziness, faintness, or collapse can signal anaphylaxis, so call emergency services. Do not drive yourself when breathing is difficult or you feel faint. Small skin findings do not make those symptoms safe. Symptoms can also escalate after a mild beginning. Itching may appear first, followed later by facial swelling or breathing trouble. Check again later instead of assuming the reaction will stay mild. Keep the medication package nearby so emergency clinicians can identify exactly what was used. When the reaction stays mild, local, and clearly improves, a cool compress may help. Avoid scratching, heating, or vigorously massaging the area. Do not inject through irritated skin. Choose a different site for the next dose and photograph any new reaction. Contact the prescriber before the next dose if a local patch keeps enlarging, repeatedly returns, or becomes very painful. Bring the photographs and timeline. The clinician can better distinguish injection irritation, infection, and allergy when photographs show how the reaction changed. Contact a clinician that day if hives or a rash spread beyond the injection area, even without breathing trouble. The prescriber may advise pausing or stopping the medicine. Do not take an extra dose, repeat the injection, or switch from Mounjaro to Wegovy as a home allergy test. A reaction to one medicine does not prove the other will cause the same response. Still, each medicine can independently cause a serious allergy. That is why a clinician should review both ingredient lists before any switch. A previous serious allergic reaction to either medicine or one of its ingredients makes restarting that medicine unsafe. Use the pattern to choose the next step. Monitor a mild reaction that stays local and improves. Contact a clinician that day for a spreading rash. Breathing trouble, facial swelling, or signs of infection need urgent medical care. Do not judge the reaction by size or color alone. Watch where it appears, how it changes, and whether other symptoms develop. Those details tell you how urgently to act. Medicine simplified. That's what this channel does. For more, hit subscribe. This is not medical advice. Consult your doctor.